The talk deals with hyperreactive patients for radiotherapy. So in general, we are basing our dose to the patient to the most 5% of susceptible patients, so to keep on the safe side. But we think and we believe that the majority of the patients can have a much higher dose and there's a high probability of being cured without increasing the side effects, and this is due to genetic changes. We have identified patients who are hyperreactive for radiation in order to have more insight to the genetic pathways involved in radiation sensitivity, and that makes part of the GENEPI project, which is a project in Europe and also involving patients from Canada, where we have at this moment more than 7,000 patients, and in the beginning of next year more than 12,000 patients, and that will allow us to look in detail to the genetics of the sensitivity for patients for radiation in combination with clinical factors like age, for instance, but also radiation factors and also comorbidity like diabetes. And we hope that in the future, just by taking a little sample of blood, we may identify patients who may have a higher dose of radiation without harmful effects and also more probability of being cured. And on the other side, patients who should have or receive a lower dose of radiation in order to decrease the side effects. The gain would be that by just taking a little sample of blood, a few milliliters of blood, and doing some processing in the lab, that we can individualize the treatment much better than we can at this moment. So we can save unnecessary treatments, and we can increase also the safety of the treatments. Because now we assume that every patient is more or less the same, which is obviously not. And on the other hand, we can even increase the radiation dose to some patients without increasing the side effects, but also we can thus increase the probability of being cured. Well, the problem is, in fact, yes, we have to wait several years, because the first step is to have a good database, which is not trivial to make that, and then in a way that we also can collect the data in a way that they are measurable and they are standardized. But now we are at the point that we can really start to do the analysis of the large number of patients we have received from Europe and from Canada.